My name's Kent Stobart, and I'm the Vice Dean of Education for the College of Medicine. Welcome this morning to the Heggie Lecture 2019. This was an honorary lecture started in 2005 to provide continuing medical education opportunities to faculty, residents, practitioners in the field of complementary and alternative medicine, and it's also open to the public. The lecture allows the College of Medicine to invite high-profile, knowledgeable, and experienced physicians to address concerns and topics in complementary and integrative medicine. Integrative medicine is a holistic, evidence-based approach to care. It reaffirms our importance with the relationship between the practitioner and the patient. It focuses on the whole person. It is informed by evidence, so it's evidence-based, and it makes use of the appropriate therapeutic approaches, the appropriate healthcare professionals, and the disciplines to achieve optimal health and healing. Integrative medicine is now being taught at the majority of medical schools across North America. This is also the Heggie Lecture, so you met and saw Betty Ann a few minutes ago. And I'd like to introduce Betty Ann and Wade Heggie, who are prominent members of this community, business, volunteer relationships, philanthropic communities, and the province for many years. Wade has been involved in aviation, life insurance, and financial planning, and has held prominent volunteer roles with several community-based organizations. Betty Ann, as you heard her speak just before here, is an illustrious career as a senior executive in the corporate sector, in the potash industry, and has held numerous directorships in public and private sector. The Heggies are wonderful supporters of the College of Medicine and the University of Saskatchewan, for which we are very grateful, and have provided tremendous volunteer assistance in attracting other donors here. Wade and Betty Ann have both an extensive personal experience in leading integrative health centers throughout North America. The Heggie Lectureship has been created through their gift to the College of Medicine and their way of articulating a vision for integrative medicine in our province. Betty Ann and Wade, if you could please just stand so our audience can recognize you, please. Thank you so much. Our speaker today is Dr. Rob Rutledge. In just a few moments, we'll have the privilege of hearing his presentation of the 2019 Heggie Lecture on From Neuroscience to Daily Practice, Evidence-Based Patient Empowerment. Dr. Rutledge is a radiation oncologist and an associate professor at the Faculty of Medicine at Dalhousie University in Halifax. He specializes in breast, prostate, and childhood cancers, and along with that, he's an internationally renowned public speaker. He is co-founder of the Healing and Cancer Foundation that offers educational videos and documentaries and webcasting seminars. And I had the opportunity to look at his website, and I would encourage you to do that as well. In 2006, Dr. of Nova Scotia presented him with the Health Promotion Award in recognition of his contribution to physician health and health promotion in cancer care. In 2010, he received the Cancer Care Nova Scotia Award of Excellence in Patient Care. His research interests focus on psychosocial and spiritual oncology, health promotion, and professional caregiver health. Please join me in giving a warm welcome to our 12th Betty Ann and Wade Heggie Lecturer, Dr. Rob Rutledge.
Thank you. I'm really excited. I'm excited to be home in some sense. My grandmother was born in 1897. At age 24, she emigrated to Purdue, Saskatchewan. So very close to here, raised 6 kids through the dirty 30s. And I figure, actually she lived to a very old age. I'll share her story with you maybe later in the talk. But I figure she raised 6 kids through the dirty 30s in Saskatchewan winters, that she was good stock all around. My mom was an elementary school teacher. So she did 1 year of college here in Saskatoon, and then was the one teacher at a one-room schoolhouse close to Saskatoon. And my dad grew up in northern Saskatchewan, got a grade 8 education, and kind of moved out of the house at age 15, worked in construction, tried to get in the military, was too young, finally got into the military, and ultimately became an officer and so on. And education was very important for him. So I just want to feel, I feel like I'm home and kind of with my people as well. So it's wonderful to be back in some sense. I want to share a bit of my story. I was talking with Ed, who's a radiation oncologist as well. And as a first-year medical student, I didn't know what kind of physician I wanted to be. And I was just interested in psychiatry, I was interested in working with people with addictions and so on. And then I had one of those kind of life-altering moments where the kind of book chooses the reader. And that book was called Love, Medicine, and Miracles. And so I was at University of Toronto, very hard-nosed scientific school, but it was dry, and my soul was not being nourished for certain. And I read this book, and I knew that I wanted to be an oncologist. I knew I wanted to run support groups, and it was, I had like a 30-plus year journey trying to understand. And Betty Ann had mentioned earlier on, like, what do people do, that the remarkable cancer survivors, the people that undergo spontaneous remission and so on. And that's been kind of a lifelong journey to try to understand how can you maximize your chance of recovery in some sense. And at the same time, I was a resident in radiation oncology. I wanted to stay within the scientific paradigm. There was a lot of quackery in those days in the complementary world. And so it was this long journey. As a resident in '93, I helped run a support group. So a social worker in the department took me underneath her wing. And so we ran a support group. In fact, we ran a men's support group in '93. And so that I didn't realize that was really avant-garde, but we called it skills building. Talk about specific, gender-specific ideas. And then it was this kind of ongoing journey of trying to understand. And I kind of reflect, from medical school in the 80s, it was kind of harsh science, physical care, to the 90s, where we're actually starting to ask, what's the quality of life of people who've had cancer treatment? And how do we measure that? And then the kind of scientific community looking at how physical healthy habits actually influence outcomes. So the whole idea of epigenetics and changing the soup in which the cancer cells were growing was the 90s, and trying to integrate that and trying to empower the people that I was helping in those days. And then we ran our first weekend retreat in '99. Skills for Healing Weekend Retreat. I partnered with a psychotherapist who's a mindfulness teacher. I was using a kind of integrative model. We've run 61 retreats since in 28 cities. And it's just been an amazing journey then to integrate that. And in those days, I was starting to give public talks, but I didn't have the science to kind of fall back on to say, this is the recommendation. So it was an uncomfortable time, but then the science continued to develop. Emotional distress, quality of life, and then neuroscience in the last 10 years. What you understand intuitively to be the mind-body connection can actually be proven from kind of neuroscience perspective. So it's been a long journey to look at, how to integrate what's obvious and scientifically based to empower people to give their best chance of recovery. So that's my background and my passion, and actually being here talking to you is where I find my bliss in life, is the empowerment piece. So this is what I'd like to talk about. It's kind of like more kind of body level empowerment, and I'll talk a little bit like kind of psychological and spiritual maybe near the end of the talk. But for now, I want to give you the kind of day-to-day kind of breaking news in terms of what we can do to integrate this from day one in the medical system. And this is going to be very participatory, and I hope fun for you as well. So your elderly parent, or maybe your brother or sister is about to undergo a colectomy. What advice would you offer them? They're a month out. They're due for their big surgery. What would you suggest to them? It's going to be about a 3-hour lecture, unless you guys start to just yell out just a few ideas. Yes, so it's that simple, in terms of the empowerment piece. So pre-habilitation is a whole science by itself now. So number one, even if they're doing walking to get the kind of cardiovascular system going. What's the next piece of empowerment? Abdominal surgery. Yeah, so deep breathing is number 3 in the list, but the core strength, they think of them, they're going to be in bed and then having to get out of bed, so the core strength, strengthening. And then inspiratory strengthening. And I want you guys to actually do this with me. Just breathe through your hand on the in-breath and out-breath. And again. Okay, so it's 1 minute on, 1 minute off for 15 minutes in a go. And I also recognized I was doing this because it actually wakes you up. Because if you go like this and breathe in, you go like, oh, I'm feeling short of breath. So you got a little adrenaline in the system there. Another suggestion in terms of the empowerment part. Carbo loading. I hadn't thought about this. So they give themselves basically a sugar shot just prior to the operation, in a liquid form. But the data suggests that it decreases those side effects. And another study showed that it's actually safe. And last thing, they've just been diagnosed with a cancer diagnosis. What else would you do to kind of help them, settle them down? Yes, agreed. Thank you. So I call it relaxation. It's a little less woo-woo type thing. So prehab. So it's the first introduction to say that we can empower people prior to their medical treatments, right? Okay. The data shows that it actually decreases hospital stays, especially abdominal surgeries, cardiac surgeries, and probably through the inspiratory muscle training decreases the complications. Can I do that with my radiation oncology patients, right? So I treat breast, prostate, and peds, essentially my 3 sites. So I want to tell you the story of my patient here, and he's happy to have his photo shown. So I met Derek 10 years ago. PSA was 49, so very high. Gleason score was 8, so aggressive prostate cancer. I said, Derek, we got to give you 2 years of hormone treatments in addition to radiation. It's really important that you mitigate by starting to exercise. Very few of my patients will actually take me up on this, and seriously, but he did. And so what he did is he would go in, it was long hours of radiation, extended hours at that time, 7 a.m. radiation, and he'd go right to Dalhousie University gym, and he started working out. And at that time, even in his elderly age, he was working part-time as a flower distributor, like wholesale type side of things. He said on the days that he went to the gym, it's as if he had more energy. He was clearer thinker, and he's a better business person and mentor, friend, colleague type thing. Now, Derek kept it going for years, and we actually met him. We were at the gym there because we were actually assessing our feasibility patients in the patient empowerment program. Happened to see him in the gym. We bump into him. He's still going like 5 days a week. He has a whole comrade of friends. He says, oh, that guy over there, he's an Air Canada pilot. Oh, and that lady there, she's like the head of department in psychology, and she runs this Tai Chi program, and I love Tai Chi, and I changed my diet. I won't change gyms, and he's very enthusiastic, lifting weights. So he's 10 years out from his prostate treatment. His PSA is essentially close to 0, so almost certainly he's going to be cured. And he's 87 years old. So phenomenal character. And so how can we help our patients do better? So on the left side of the screen is actually my wife, who is a prostate cancer quality of life researcher. And so I've been treating prostate cancer for 23 years now. And what do you think happens on the follow-up visits? Hi, how are you? I'm fine. Yes, now we're starting to get a bit more scientific in terms of looking at the side effects. But the men are putting on a brave face. And I'm thinking, my guys are doing great. They're not having many side effects. But you know that is erroneous, that physician assessment versus patient-reported outcomes, 2 different things, right? So then she comes in and creates a survey, multidimensional survey of like now 400 men with prostate cancer. And it was a shocker for me, Mr. Mind, Body, Spirit Medicine guy, to realize that the guys are actually suffering a fair amount. So that was started the journey of finding out that this is an epidemic of silent sufferers. Okay, so I ask you, what is the prevalence of mental distress in men who've had a history of prostate cancer? Give me a number. Yeah, a lot of the guys, right? And if you ask them How are you doing emotionally? They'll say, oh, I'm doing fine. If you embed a quality of life questionnaire that actually screens for depression and anxiety, it's a whole different number. And so essentially, and I'll show you the numbers, 17% at any one time have like a clinical depression, or at least meet the screening diagnosis for depression. 27% have anxiety. And there's obviously an overlap. It's probably in the 35% range of everything. So, so why do you think it is? What are the contributing factors to the fact that these guys are hurting, suffering mentally, psychologically? Why do you think they're hurting? Yes, so they're not accessing and connecting and learning and empowering themselves. In fact, a lot of the guys just think, well, this is how it is. There's nothing to be done about it, right? What else? What are the real factors that are physical? What do you think? They go through their treatment, they get what? Incontinence, erectile dysfunction, right? Sleep problems. Say again? Impotence, exactly. That's the point. And that changes their perception of themselves and so on. So we did that survey. So Gabriella's hard work. 383 men, a third of them not having treatment yet. 19% had scored positive on mental distress. 75% reported issues around sexuality and intimacy concerns. And this is very consistent across multiple studies. 57% had at least mild urinary symptoms. We did a survey, I did a chart review. It was about half the guys, if the physician was assessing them, saying the urinary function was normal. And yet every single guy didn't qualify according to that survey diagnosis as normal. The odds ratio for mental distress was 3 times higher if they're suffering from moderate or severe urinary symptoms, right? They're not probably sleeping at night. They're cutting themselves off socially because they're embarrassed to have urinary leakage in social circumstances. Sleep problems, right? We know that we have poor sleep, our mental health worsens. And again, worries of sexuality, intimacy, and their kind of role in that respect doubled their risk of having mental distress. And just think about it, often the guys, if they have their cancers come back, then they get started on hormone therapy. And hormone therapy causes a whack of side effects, including these. I'm not going to read them to you, but you understand hot flushes, fatigue, and kind of the biochemical syndrome, risk of heart attack. So they get weaker for certain. So, and here's the summary again. So many patients and studies, and it really didn't change over time. 17% depression, 27% anxiety. And just as you said, this kind of silent epidemic, the guys at home suffering, not realizing that they can actually empower themselves. So if you know that's true, if you know they're kind of in the more depressed anxiety kind of spectrum, what would you do to actually improve their mood or decrease their risk of mental health issues? What are the components of the program that I'm going to talk about? Exercise, number one, always, yeah. Work with their specific issues. What else can you do for mental distress? Support groups, so connection, yeah. Meditation, good. You guys are smart. This is a smart crowd. This is great. Exercise. Yeah, I really could rant for about 15 minutes about the benefits of exercise. But why don't you guys all stand up right now? Stand up. We're going to make this a little more participatory. And to the degree that feels good for you, you can do squats on the spot here. What are the tricks that improve the chances that you're going to do your exercise? All right, hold the squats. I need to hear at least one person give me, how do you make yourself do it? What's the trick to all this? Yes, make it social, right? Good. Yeah. You have to sit down if you have it right. No. And what's the recommendation? How much? How hard? Moderate. And what's the last thing that we should add? Let's do the squats again. What else is part of the exercise program? Breathing, sorry? Consistent. What else do you have to integrate in your exercise program? Yes. How about strength exercises? Okay, you can sit down. Good. Thank you. You guys are great. Appreciate it. So it's a new American College of Sports Medicine recommends twice per week strength training. 8 to 10 muscle groups, 8 to 15 reps, 2 sets, right? Including squats, glutes, that type of thing. So it's half an hour here. And this is actually a talk around cancer-related fatigue. And I just wanted to show you, the patients who are getting tired is actually counterintuitive, but to exercise actually improves outcome. And you can see in the bottom line there that exercise has the greatest influence and the most studies. So exercise, exercise, exercise. So that's the first thing. How can we get the guys to exercise? The aerobic training up to 150 minutes, building themselves up there. So then it was strength training. And what I've shown you here is a home-based program that we taught these guys. So they're using straps, essentially, like different exercises like that. And then they would do squats against the wall. So muscle, body weight and so on. And the idea was that we wanted to have them do this twice per week. Right? In addition to the aerobic stuff that we were recommending and all the core muscles and so on, they go through essentially 2 sets of this program, 2 different workouts. The third component is actually looking at a symptom that a lot of the guys suffer from, which is urinary incontinence. And I learned an awful lot about the kind of physiology. So it was a really very, very fun project. Got a physiologist, actually a PT, to help teach us around this. And one of the ideas is that if you contract your pelvic floor all the time, it doesn't actually allow the muscles to get stronger. If you're going to train and get a bigger bicep, for instance, you wouldn't hold your bicep like that all the time. You would actually want to have full range of motion so that the muscle can do its work. So some of the guys are too uptight. They actually have to learn to relax the muscle before they can strengthen it. And secondly, there's both slow twitch and quick twitch muscles within that pelvic floor. So we created a program and we created the videos. In fact, I was on the videos. I'm like, contract, hold. In fact, why don't we do this together? You can fake it. It's okay. I want you to try to contract, as if you're trying to stop yourself from peeing. And I want to see if you can still breathe. So contract. You can cross your eyes if you need to. But the idea is to relax everything else, contract the muscles, and keep breathing. Good. Great. Thank you. So that's participating. I'm not sure you're going to do that in many other public talks. So it actually improves urinary incontinence. And if they do it preoperatively, you actually have a higher chance of being continent at the 3-month point. And it improves erectile function and even bowel function, which is what we found in our study as well. Think about the kind of anal muscles getting stronger, so less rectal incontinence. We're asking them to do a lot, though, 10 minutes at a time, 3 times a day. We created a reminder system, so we actually got a computer science student, first-year computer science student who's the son of one of the radiation oncology residents, to create an app for us. And if they didn't have an app but had a smartphone, we would actually text them 3 times a day, ding in the elevator, who's that, honey? Well, I got to do my Kegels now. So that was what the app looked like, Patient Empowerment Program app by RJAV. And the guys actually used it. It worked. They said the functionality could be better. They could change the times and so on. So this is a feasibility study. So we're just seeing if we can get the system going here. I want to show you this one. It's a technique that we taught the guys through the program called blow before you go, which essentially decreases the risk of urinary incontinence in a high-risk scenario. So, for instance, if you have to stand up, and that's a risk factor for leakage, or you're going to go pick up some groceries, and that's also like the strain of that is also a risk factor, then through this program we taught them this. And so I'll take you through kind of the steps there. So when we do the Kegels, we don't want to have a big abdominal pressure. It's not during the in-breath. And everything's kind of pushing on the roof of the urinary bladder. In fact, you want to blow out, so there's less abdominal pressure. And then you hold your breath and you Kegel at the same time, and then you do your activity. So And then once you're kind of up, then you can relax. So I'm going to do it once, and then we're going to do it together. So again, this is going to be fun for me. So if you're sitting down, exhale, hold your breath, Kegel, stand up, relax. Okay, you guys ready? So just relax breathing to start out with. Focus your mindfulness on your breathing right now. On the end of the out breath, hold your breath, Kegel. Everybody stand up now. And relax. Good, wonderful, thank you. You could have faked it again. Okay, so in the last part of it, I think you would have identified is practicing a relaxation or meditation technique. And so we actually had a session on a Saturday morning with 30 guys, super attentive, and the wives in the background, a whole other set of people, or partners I should say as well, watching this demonstration and taking them through the Kegels and all the rest of it. So we taught meditation to them. And I just want to quickly go through some of the science. And also you think about, here are some techniques that you can actually teach to people. Have you seen the hand model of the brain? No? Oh, good. A couple people then. Okay, so the wrist is the spinal cord, and then the first level of evolution is the base of the thumb. So that's the reptilian brain, or the fight and flight center. So that's the first thing, like 600 million years ago in the nervous system, between sensory and motor, is the base of the thumb. The next level is the limbic system, which represents the thumb. That's the emotional system. It's the reward-seeking system. That's approach for sex and food, essentially, that system. So through evolution, it's the next floor of the house being built. And finally, our human brains, mammalian and then very human, is the neocortex coming out to the frontal lobe, essentially. And you can see the relative anatomy of this, right? So as you practice meditation, the frontal lobe gets thicker and stronger, and it's overlying the kind of what I call the stressed and irritable limbic system, right? So when we practice this, we get stronger. We can dampen down the more primitive pathways within the brain itself. These pathways serve their purpose, but it's better to live out of your wise and compassionate brain, which is the frontal lobe. So meditation is very helpful in many of these aspects. And I just want to give you the quick, because there's something called neuroplasticity, your brain continues to change and grow throughout your lifetime, and you can kind of reverse engineer that into helping you stay in more positive and clear thinking states. As you practice meditation, you actually innervate the insula, kind of inner aspect of the temporal lobe. That's actually interesting because it allows you to feel what you're feeling within your body, which is the called interoception, so self-awareness. And interestingly, we pick up emotional cues off of other people through a kind of physical mirroring and mirror neurons. And so we actually have better empathy for emotional content there through meditation, because that's the part of the brain that's associated with both that. Hippocampus, obviously, as the kind of memory center of the brain. We actually grow new brain cells as we're learning things. So, for instance, London, England taxi drivers who go through this 3 course to learn this kind of spaghetti gnarl of streets, their hippocampus actually grows over the 3 years because they're trying to learn so much information there. And as you practice meditation, the amygdala actually starts to shrink. So your alarm bell system actually shrinks with time. And then obviously the frontal lobe is the kind of wiser, more compassionate part of the brain, creativity, morality, et cetera, et cetera. So it also, the balance between the left frontal lobe and the right frontal lobe, the more innervation you have the left frontal lobe associated with meditation, the happier you are, generally speaking. So it's that balance between the two sides. There's this kind of being able to see the kind of self-awareness or consciousness through the gamma wave activity. And ultimately, by practicing meditation, you have decreased, so the telomeres are those bits at the end of the chromosomes. There's less of kind of eating away of the telomeres if you're practicing something that's more relaxing and settling down the kind of stress system. Here's a nice little study. So essentially, you can look at blue dots in the bottom right-hand corner. It's essentially meditators over the decades. They actually maintain the thickness of their frontal lobes during that time, whereas most people have the normal 2 to 3 to 4% deterioration in thickness of the neural material with time. So your gray matter shrinks with time. The meditators actually maintain the thickness over the decades. Lots of physiological, that's how decreased cortisol, stronger immune system, response to flu vaccine has higher immune output in meditators. A whole bunch of other conditions are improved through settling down stress system and kind of reintegrating body side of things. Psychological benefits. So that's the center of attention. It's the center of compassion, connection. And because of that, it helps in lots of different ways. And I thought I would share my own meditation practice, just because it kind of normalizes this as well. So most days, now we go into the kind of little meditation little room. I have some mats there. I set my attention on my breath. So I'm kneeling down. I'm focusing on my breath. And within about 3 seconds of starting my meditation, I'm starting to think about what I need to do that day and what's happening at work and there's a DRO meeting and all this stuff that's happening. At some point in time, I recognize that I'm thinking about work and not actually focusing on my breath. And about 3 seconds after that, I'm starting to think about what happened yesterday and I shouldn't be so silly at those meetings and why can't I just shut up? And it's like so stupid. At some point in time, I recognize I'm fantasizing about what I could have, should have done and bring my attention back, and then I'm off again and bring my attention back. Meditation is all of that. It's not just the last, 5 minutes where like, I'm feeling more relaxed and so on. It's like becoming friends with the whole process. And especially it's developing the muscle of bringing your attention back to whatever the focus point is. And I recognized over the years, the mornings that I was meditating, that I was much more clear of mind. I was doing one thing at a time. I was efficient. I was looking that person in the eyes. I was able to connect with them. I just felt like I was a better physician when I was meditating. And then as the years went by as well, I recognized that I'd be in the midst of a conversation, and then suddenly I'd be thinking about, I got to do that after work. And I recognize I'm not even paying attention to this person. And I'd bring my attention back into connecting with them again. So it's had a very positive influence on my kind of resetting my kind of stressometer. I'm at a much more level position, much like able to think more clearly, I really think. So the other thing that someone said is like the social stuff. And so we wanted to actually teach them to facilitate better relationships with their partners. And this back to the lecture again. They call it feminine or masculine qualities. Doesn't much matter. We're human beings, and we want to connect. The best way we can connect is actually to listen and connect and care about that other person. So some of the teaching around that. There's this idea of intimacy, and when a lot of people in Canada, US, whatever, they hear intimacy, they hear sexual intimacy, right? But there are dozens of types of intimacies, and in fact, you can contemplate in your mind, what are the activities that you really enjoy that you do with somebody else, right? And so yes, there can be the sexual activity, but what are the other things? You enjoy watching films together? Do you enjoy going for a walk together? Do you have these social activities? Do you enjoy sharing your reflections, of a book that you're reading? So we all have a kind of intimacy profile, and if we can find an overlap with our partner, then it's a way to connect with time. And people doing this exercise, we run a day long, people doing this exercise like, oh my goodness, there's so many types of intimacy in my life, I didn't even recognize it. But then they can also prioritize and say, I can change over, and I don't like that activity so much. I want to spend more activity with my grandkids, for instance. Emotional vulnerability is really, so we're telling the guys, tell your partner how you're really feeling. Use the emotional words, like I'm feeling upset with what happened today. Like, it's not those guys are idiots. It's like, I'm feeling frustrated about what happened is the kind of teaching. Physical touch, so ask for that cuddle or hug, all the oxytocin and the positive benefits associated with that. Here's a very specific one. We say once a week we're scheduling a play date with your partner. Make it part of your life. something you both enjoy, for instance. So we did that during the teaching originally, and then, well, ask for what you want and offer what your partner likes. So this is the overview of the entire program. And what you'll see, like Monday to Friday, and the aerobic and strength and connection and so on, it's a pretty intense week, right? It like adds up to like 70 minutes per day to maximize your mental health, supposedly, or such is the hypothesis. So then how do we get guys to do it? So that's my question to you. Like, how do you, like, it's not enough in my mind to hand over a pamphlet to somebody and say, exercise, right? Or go to this website. I just don't think it's very effective. We know the compliance rates fall off very, very quickly in those type of programs. So what do? Yeah, so you're going to facilitate those side of things. So what we did is we wanted a kind of connection. So we were emailing them, and we created a little 2-minute YouTube video and say, okay, guys, it's day 1 of the program. Thanks so much for, you're part of science. We want to help. So it was creating a relationship between the facilitators and the participants. The second thing that I thought was bold is that we asked all the guys to phone 2 other participants once per week. And I didn't think, the guys, they're not going to want to do that type thing, but this was maybe a remarkable group of men. And I'd say, tell them how you're doing within the program. So there's a little bit of kind of accountability and support that was happening on that side. And really, a kind of the takeaway point from this lecture is that if you want to kind of facilitate change in people, it has to be done within relationship and social connection. And I really think Saskatchewan has an opportunity, because you're a kind of very connected society. They have an opportunity to create this programming and have the guys support each other. I think that we have to break the paradigm of we are the physicians, we know what they need to do, and that we will tell them what to do, and that's the end of the story. It has to come actually from community as well, including that kind of exercise program. Go outside of the kind of medical box. Okay, so what did we accomplish? So we accrued over about 6 weeks. We got 30 guys to sign up, mostly from support groups. They were older, and yes, whatever, 6% had non-Caucasian background, highly educated, higher incomes, et cetera, et cetera. Mostly they were treated at some distant point in the past. And we asked them to commit to a 28-day intensive program. Now, interestingly, the compliance was essentially 100% from the pre-assessment to the post-assessment. It's unheard of in studies to get that type of compliance in terms of assessment there. And now it's being published. We have, it's in press, so to speak, in that journal. So what are the assessments? So we did that comprehensive online survey. It takes about 25 minutes looking at all aspects of quality of life: blood pressure, body mass index, abdominal girth, and fitness testing. And then we also wanted to see if they would actually change their kind of stress levels through kind of EEG, and I'll explain the heart rate variability in a moment, to see if their brains had actually changed over a month. And then once per week, we're seeing if they would actually comply, and that could also be part of the prescription or the suggestion. Is if we're asking them, then they're more likely to do it. So here we're testing balance tests, up to 45 seconds, eyes open, eyes closed. Eyes closed is quite hard. 6-minute walk test, it would go like 500, 600 meters. Flexibility. Luigi's acting up here, but he's going to do a grip strength. He's 83 years old, going through all this. And then the sit to stand is how many squats you can do in 30 seconds. And you can see there, Luigi is more flexible than I am in hamstring flexibility. We wanted to see if their brains would change over the 28 days. And this is all feasibility, right? So we're not kind of scientifically expecting things to change, but that was where we went. And so it's a Muse system that's assessing the electrical activity in kind of temporal and frontal lobes. And then, have you heard about heart rate variability? So yeah, a few people. So essentially, our heart rate actually continues to vary throughout the day, right? So even if you're going an average of 60, you're going to kind of 5 seconds from now, you're going to go 61, and 2 seconds after that, 59, and so on. And the more you actually kind of fluctuate, the more the parasympathetic nervous system is engaged. The more stressed you are, the more kind of fixed and tight you are, the more your heart rate variability will flatline, kind of like neonatal assessment as well. And so we had them assessed. It's a little monitor that goes on the earlobe, and then it's a kind of printout to the screen. The middle one is, it's actually an icon that kind of opens and closes, so we're getting them to breathe slowly, but they're getting immediate feedback in terms of how much their heart rate variability is going out. And the last one on the right side is a kind of printout of what percentage of the time they were in the green zone and so on. I think that's one of my lines that I do in the morning as well. Interestingly, so we did it pre and we did it post, and some of the guys in the focus group said, I didn't like that meditation stuff very much, but I really like that kind of monitor thing that you have there where you get to watch your breath and all that stuff. And so for the actual randomized trial that's coming up, where actually each of them is going to have their own monitor on an ongoing basis. And there's really strong scientific data that if you use that type of monitor and teach them to increase their heart rate variability, they can recover or have improvements on all sorts of other ailments like diabetes, hypertension, like all sorts of PTSD. There's all sorts of science behind teaching this particular technique and changing the kind of brain waves. So what did we see? So N equals 30 guys. On average, they lost 3 pounds of weight. Diastolic pressure was down, increased flexibility. Now, some of the guys had lost like 20 pounds in a month type thing. So, it's variable. The more, I don't have the science for you right now, but the more the compliance, the more the benefit. At baseline, 6 of the guys, 6 out of 30, screened positive for mental distress. At the end of it, only 2 guys had screened positive for mental distress. And again, these are questionnaires embedded within like a 30-question questionnaire, so I don't think it's like a reporter bias in that circumstance. And they were saying literally they were feeling better during this time. There was very high compliance, and I think it's a very remarkable group of men who joined this study, but they actually overperformed in a lot of circumstances. But even pelvic floor exercises 3 times a day, 76% of the guys were there. Intimacy, so essentially we're asking them to do one type of act of intimacy per day with their family member, spouse, friend. It doesn't much matter. I mean, one of them was like on Sunday, call somebody who lives at a distance from you was the kind of recommendation for each Sunday, right? Kind of like Bell Canada or whatever. I'm not sure if you had that in Saskatchewan. They also said that they would highly, highly recommend that program for people who are just diagnosed or others with a prostate cancer diagnosis. And then the last kind of paradigm shift that I want to kind of suggest is that we need to engage the patients, the people themselves in the research. So they're going to partner in a randomized trial. We're going to actually have mentors so that the newbies coming in with a diagnosis will have like a list of people, make little videos and contact information. They can scroll through the internet like a speed date. I think that guy's interesting. He could be supportive, and they'll contact them. So the mentors and the newbies are hopefully going to connect, right? So again, you're connecting people. In terms of the study, here are all the kind of realms that had statistically significant improvements there. And yes, this could be data fishing, et cetera, but really, you would expect this type of change, and it's consistent with what they were saying in the focus groups. Interestingly, so you can look at the bottom curve, which is actually the measurement of, I think it's frontal lobe in that situation, and it's the theta waves. Yeah, theta right and left. The dashed is before, and the, did I do that? Oops. I just turned it off. Oh, and I turned it on again. Okay, try that. Yeah, okay, good. So dashed is before, and solid is afterwards. And higher on the chart is better in terms of that kind of theta wave, which is a positive energy. And what you're seeing is a significant kind of upping of the theta waves after 28 days. Oh, video. Great. Enough talking from my side. I think it's best that you hear it from the gents themselves. Maybe I'll just introduce them shortly. The first guy had his prostatectomy 5 years ago. He had been going to a physiotherapist like multiple times. He was one of these volunteer patients for the medical school and so on. He was doing his Kegels like 5 minutes a day type thing, and he was still suffering urinary incontinence. So I just want to, give you the kind of broader overview. Testimonials.
The biggest problem I've had following the surgery was incontinence. And that, it's been 5 years now since I've had my surgery. So I had Depends, sort of adult diapers, for some time. It's embarrassing. It's not pleasant. If you cough, you sneeze, oops, anything you've had to drink was there. It makes you think, should I try to drink less? But no, I've got to drink because you need the fluids. If you're going out to try to shovel, you've got to I used to take a lot of paper towel over the pad, let that get the initial leakage when you'd be shoveling or doing anything strenuous whatsoever. Through this program, there's a different series of Kegels and different exercises, and they're lasting for me about 15 minutes and doing it 3 times a day. And I would say during this past month, I'm about 90% drier.
The surgery had a profound effect on me. And the loss of sexual function had a profound effect on me. So when I started this program, I was struggling, and this program was a way for me to turn it around.
Programs help me to be motivated in terms of my physical fitness. And so, yeah, I'm way less now than I did a decade ago. They're not able to have an erection. That can be a very devastating thing for people. And it kind of brings a dynamic of loss. And I would say that part of what my wife and I have gone through over the past several months now has been grieving this loss. And it's a funny thing because I present well, I look healthy, but there's a loss still that we're going through. I remember Dr. Gabrielle has talked about intimacy, and my wife and I have joked about it sometimes at home, where I say, I need a touch, I need a hug. And I've certainly been, I think, more expressive in my own demonstration. I've always been a kind of a tactile person anyways, but I think even more so since this program, because I'm exercising, because I'm being very careful about what I eat. All of this is part of the motivation that I've received from the program. I'm in a better space.
Yeah. So, that's a feasibility study, maybe some remarkable guys, but we do actually want to run this, do it right, do it scientifically, randomized, and essentially it's all the guys due up for radical treatment. It's standard of care, but we're just adding on the 6 months of, that multiple aspects of the program. And then the primary outcome is actually mental health. So it's a K-10 questionnaire, measures for anxiety and depression. And I won't ask you to memorize this one, but essentially that's the shape of the protocol. So you see the randomization between early arm, they basically at their 180 days versus the late arm. So, and the guys are being measured baseline at 6 months and at 1 year. Okay, I have to tell the story of my grandmother now, because it's good Saskatchewan stock here. So I'm telling this story partly because what I presented to you so far is very kind of physical medicine. Yes, meditation a little bit and so on. But there's a whole other element of healing that happens at the kind of psychological level and at the spiritual level, and that's a whole other kind of talk. But I really think a lot of people just check their spirituality off at the cancer center, front door type thing, and they forget to bring what's most important to them. And so I want to honor my grandmother by reading from a story from our book. So the Healing Circle is essentially the teachings from an entire weekend retreat, kind of body, mind, and spirit. And then every second chapter is a story of someone who's attended the retreats. And it's a story of my grandmother. On the eve of my grandmother's 110th birthday, I got a call from the nursing home that she was having chest pain. I was worried she was having a heart attack and wouldn't make it to the big celebration the next day. That would be a shame because my grandmother was an amazing woman in many ways. She lived in her own apartment till 107, composed poetry up until her final months, and was an exceptional conversationalist with her many visitors. Yeah, she got kicked off the nursing home list at age 100 because she was too fit. That's how good she was. At 109, she pledged herself that if she made 110, she'd dance on the tables. Yeah. Unfortunately, her health did go down during that year, and she was mostly bedbound up to her wheelchair. But she was still cognitively sharp. I rushed over to the manor to see how sick she was. When I got to her floor, I could hear the sounds of lively violin coming from her room. 3 of her great-grandchildren, who are all excellent musicians, were serenading her with songs both lively and poignant. Forgetting about the symptom of chest pain that brought me there, I sat back and listened. The lyrics of one soft song started with, "The birds have flown away." Listening to the beautiful harmony of their young voices, I began to quietly cry, realizing this would be one of the last memories I'd have of this extraordinary woman. Grandma lay in the bed with a smile as broad as her face. As a doctor, I could tell that her body was very weak and that she would not last more than a few weeks. But there she was, looking so happy, at peace, and absorbing every moment to the fullest. And more than that, there seemed to be a glow emanating from her that lit the room with warmth and joy. I've experienced that same feeling at the bedside of many people who've released themselves into something so deep and mysterious that their inner light was obvious to everyone. Whenever this has happened, I've walked away from a simple conversation, lighter on my feet, and with a feeling that my heart had been stretched open. My grandmother reminded me that a deep connection to spirit is possible even as the body is fading away and turning to dust. Over my years as a doctor, I've seen many of my patients who've been able to let go into the realm of spirit, no longer identifying so closely with their bodies or even their personalities. Something like a pain crisis might dim their light, but once the pain was under control, they would settle their minds. The brilliant light of their spirit could shine through again. I remember a young mother I treated during her initial breast cancer diagnosis and again after it recurred. She had such exuberance for life regardless of her physical health. We had to delay her initial radiotherapy session because she had torn open her mastectomy sutures during a snowball fight with her kids. She was spunky. Years later, when she was in a terminal phase of her life, I saw her again when she needed radiotherapy. Walking into her room, I could see that her body was frail and her skin yellow from cancer in her liver, but her face glowed and her eyes were filled with deep love. Though too weak to get up to greet me, she extended her arms up for a hug. Her voice rang out, "Dr. Rutledge, I'm so happy to see you." And I leaned over for a long embrace. She held not a hint of bitterness about her situation, and I walked away from the clinic that afternoon with a lightness in my heart and an aspiration to share my love with others. When we slow down and are mindful of the true beauty of life, we can become more aware of the realm of spirit. It's here all the time, yet so obvious we can overlook it. I'm truly grateful to my grandmother and so many of my patients who have lit the way, showing me the light of their living spirit even as their bodies were fading away. P.S. As it turns out, my grandmother's chest pain resolved that night, and at the party the next day, she conspired with 2 large men to place her wheelchair up into a large wooden table. She had everyone in attendance sing songs to her like, "I'm tired and I want to go home," and all the time her legs kicked and jigged in rhythm on the table. Thank you. So, $20. It goes to our charity, which obviously gives the seminars and weekend retreats, and it's here for you, DVD, and there's the card there. I want to acknowledge an incredibly diverse, almost international team that helped through the PCPAP. My wife not in the picture there, unfortunately, and super happy to answer questions. And maybe just one quick plug for giving a talk tonight. About fear of cancer recurrence. If you or a friend has been affected by cancer, then this is quite pertinent to do specific things can actually work with that anxiety and heal in some sense. And then tomorrow, I'll leave that up in a second here. Tomorrow we're actually offering a day-long seminar, and we partner with Breast Cancer Support Saskatoon in offering that. So it costs only $25, and it's actually the passion of my life. So very, very happy to answer questions if people want to discuss this. I'm happy to chat with you afterwards, too.
Is your grandmother still with us?
No, she died in 2007. Yeah. Amazing, amazing. I mean, go ahead.
I read a 114-year-old lady just,
Yeah.
she must have been one of the oldest women in Canada.
Yeah, we were thinking she was in the top 5 for certain, and anyways, we've been blessed with good genetics. When she was losing her ability to see, she would do games in her head to keep her mind sharp. So she took the word adventuresome and mixed up the letters and created as many words as possible. She came up with 64 words. I would get like 5 words, like
Numbers 101.
nice, 9 to go or plus. About quality life. Thank you. Please.
Specific measures did you use for the anxiety and the quality of life?
So the questionnaires were all standardized questionnaires, and I'd have to kind of bring up this very large group of table and assess multiple realms. But the actual questionnaire that assessed anxiety and depression was K10, the Kessler psychological scale, 10 questions. Yeah.
How is your program sort of really broadly accepted by your oncology colleagues? Did you see any movement in other people being inspired to create and become
Similar
involved?
programs, yeah. Watching kind of the evolution of oncology with time. So like exercise is now being much more integrated, right? We have an exercise program. The physicians are referring. What I would say from kind of, because I know this is a physician audience mostly, is, I mean, we physicians are delivering what I would say mostly physical care. You're trying to take care of that person in front of you, give them the best care, education, et cetera, but there's kind of a limited time there. And so I really think it's not really going to be the physician's role to pump every program other than to say, this is very good for you and I suggest it, but not to spend the time too much going there. I think what has to change is the medical system has to change such that there's an extra appointment prior to the first consultation that includes the empowerment piece, education, and then the things people can do. And so that will be scheduled and every single person will go into that. And then we'll get them again during treatment, but the idea is to facilitate the empowerment piece prior to getting the actual physical care is how I think about it. Yeah. Because the physicians are incredibly busy, as are the nurses and so on. Yeah. Yeah. Thank you. Really, really appreciate this. Yeah.
Thanks very much for that great talk.
Thank you very much. Appreciate it.